Thank you, Christina. You knew I would forget. That's why I asked you to help me remember. All right, welcome everyone. We are going to go ahead and kick off our September 50 State Retail Program Manager quarterly call. I want to thank you all again for taking the time. It looks like the flow of attendees is slowing down a little bit for those joining, but I know the ones that will come on in the next few minutes will have no problem catching up because we just have a few announcements here to kick us off. So Steve Mandernack sends all of you his regards, but he is unavailable today. He had a conflict with some travel that came up, so you guys are stuck with me today. But with that, I'm going to just run through some updates with training and opportunities that AFTO has for you that may be of interest and benefit to your programs. So with that, we'll go ahead and get started before we get to the meat of our discussion today. Okay, there we go. So first, I wanted to talk to you about the fall webinar series. This one I put first because you will be receiving it in the AFTO e-news that comes out today, but this one is hot off the presses and I didn't see the e-news before joining this call. So this is the first, you're the first ones to see this. We have an exciting lineup of what they're calling Fresh Take Fridays coming up starting November the 1st with some really great topics. I know y'all don't need me to read all those to you because we're going to be sending the recording of the meeting out. So you'll have this QR code at your fingertips to be able to sign up for our Fresh Take Fridays starting November the 1st. Next, here's another one that was in e-news a couple of weeks ago, and we just want to make sure you're aware of this upcoming webinar. It's for the Ethnic Food Toolkit. You can register by the link there on the slide or the QR code as well. But there's some great tools and resources for your staff that come across different foods, and they're continually building to this toolkit based on what folks are telling them they're seeing in the field and they need more information on. So it's just a really great resource for you to have tools at your fingertips and for your staff to have those tools as well. So this webinar coming up on October the 4th, so in just a couple of weeks. Other trainings we have, in case you haven't seen this handout at the AFTO booth, we're making our way around to all the FDA seminars that are coming up. We had this one at the Chicago seminar that happened last week. And I know they'll also have it at the Pacific one coming up, I believe, in a week or two. But we have our AFTO training menu. This one includes amazing courses such as instructor skills training, communication skills, basic investigations and inspections for new retail and manufactured inspectors, the upcoming boot camp dates for inspector boot camp. This one, it gives all of the classes that are coming up, the free ones, the ones that aren't free, the ones that are virtual, the ones that are in person. So just make sure you pick up the handout when you see us at the AFTO booth, or you can find this on our website, apto.org, and then click on that training tab. One of the classes that you're going to see listed in that menu is the root cause analysis training. This one's just a really great training for when you, it's really geared for more seasoned inspectors and those that are doing foodborne illness investigations, but it really helps inspectors get in that mindset to look at the root cause of why you have recurring violations and maybe get to the root cause of an outbreak. So super fun and interesting course if you're interested in seeing that. And we also have the environmental sampling class. This one is one that we bring to your jurisdiction. It's a face-to-face workshop, and we can host it in the location of your choice if this is something you're interested in putting on regionally or at a local area where you have a lot of foodborne illness investigations taking place. It's a really great workshop. You can also find the link there in that same on the same website. All right, the AFTO Credential Series. Just a reminder, we do have the AFTO Credential Series that supports food safety regulators. The first credential requires no experience, so it's one that's super useful for those that are just getting started straight out of school or they've just started with your agency. All the content of these credentials is based on the National Curriculum Standards from IFPTI. So there's no 4-year degree required. So this is a perfect option for also for those code enforcement officers and the states that are evolving the way that we hire our workforce. So you want to be recognized for your mastery of those skills. Here's another credential option for you. And if you do need new staff, you have some openings you want to get out there, don't forget APTO has the Food Safety Careers website. State agencies can log in to post their own positions, or you can send them over to APTO at apto.org, and we'll make sure they get there as well if you're trying to get the maximum exposure for your food safety positions that you're looking to fill. And that Food Safety Careers website, we also do a lot of promotion at colleges. So if you have openings for brand new level inspectors, that one we also we promote there at the college campuses as well, just to help fill those positions and get new blood in the industry. Next, we have a brand new freebie exercise. We're calling it a freebie because those of you that have been around a while and worked on mock foodborne illness investigations, that was their original name, but we haven't had new ones in quite a few years. And the ones that lived on the FDA's website, well, they didn't really focus strictly on a retail situation, but now we have one that does. You can find it on our website on the resources page. So if you are working on Standard 5 and you need a mock foodborne illness investigation for a plausible retail outbreak scenario, this one, it's great. It evaluates interagency collaboration and jurisdictional issues and goes into the communication between agencies involved. So it's a really great exercise, and I hope you take advantage of it. Got to put out the save the date. We had an amazing APTO AEC in June this year up in Michigan, and the one in Dallas, it's going to be here. I don't want to say before we know it, but we have already started the planning. So in my mind, it's going to be here before you know it. June 21st to 25th in Dallas. So please mark your calendars. June is a great time of year to be in Dallas. So we hope you'll go ahead and put that save the date on your calendar. The last two things I have before we get to our presenters today. A Harris Pulse food safety survey was done, and we want to make sure that you're aware of where to find the information if you need it for anything that's coming your way. They did a baseline consumer understanding of food safety concepts, and what they found was very encouraging that consumer perception of food safety and regulator perception of food safety are not often the same thing. But it shows the importance of the mind of American adults of food safety inspections and food manufacturers. So make sure you have this resource bookmarked as well for anything that may be coming your way that you need a little bit of data for as to how consumers see what we do. And last but not least, speaking of things that might come your way, APTO does have a legislative tracking page. We maintain this page for you. So all the state bills that are related to food and cannabis that have been introduced or are active during a legislative session, you can find them on this webpage. And we also archive previous year's bills regardless of the outcome. So if you have some crazy legislation coming your way, like they want to make it legal to sell tamales out of the trunk of a car, hopefully you don't have to deal with that one, but it's happened before. So this is a place to find who was responsible for that and be able to talk to someone that's already been through that. Just another tool in your toolbox as we face another legislative session. And oh, I lied. There is one more thing. So I spoke to many of you that are on this call today over the last year while conducting our periodic state retail food program survey. And I had asked you a question on that survey about potentially assisting with the distribution of our next industry survey that is focused on small food establishment operators. We know that a lot can change over a year. So I'm going to be sending you a very brief, like less than 8 questions survey just to verify what you told me last year. And it's just on capacities on how to assist with distribution. If you are still interested, and then that will hopefully save both of us a little bit of time, because if you don't answer the survey, then I'm going to be reaching out to set up a meeting just to make sure we still have correct information for you and how distribution may be possible. So please respond to that when you see it come in your inbox. You'll probably see it on Thursday or Friday this week. And with that, enough of my rambling and rapid fire information. We're going to get to why you are really here today. So by your request, based on the evaluations that come out of this call, we have a panel discussion today on HACCP and specialized processes. So we're going to talk about these risky food retail processes and get some more resources to use that are available for you. To start this discussion, first up, we have Sally Flowers, AFTO's Scientific Affairs Director. Joining her, we're also going to have Veronica Bryant and John Wheeler. I know you're all familiar with everyone here. They're great names and valuable SMEs in our industry. And with that, I'm going to turn it over to Sally.
Well, Deanna, you're also a valuable SME, and thank you for that. So I'm going to steal the screen from you. All right, can you all let me know if you can see my screen okay?
Yes.
Thank you, thank you. All right, so what I want to talk to you all about today is a new service that AFTO has just launched. So just this month, we have launched a HACCP review service for retail HACCP plans. And so where this got its start, we had been in conversations with several of you all at the state level, local level, and also with industry. And what we learned is that several challenges came to light when it comes to the review of retail HACCP plans. Some of the key points there is that staffing, we tend to be understaffed sometimes, we don't have enough of people that have a background that can evaluate novel food processes or retail HACCP plans or both. Also, we're always going to have competing priorities. HACCP plans sometimes can get backburnered in their review because urgent items pop up all the time and keep shifting to the top of the list. And so within AFTO, so Deanna and I and several others got together. We took this feedback. We talked with several of you all, and we've been building this review service with SOPs and tracking systems and so forth to come up with some solutions to this. So we've run this by the AFTO Board of Directors. Several of you on the call probably saw a version of this back in Grand Rapids. So you're going to hear some of this again, but with new information. And also several industry representatives, and then one-on-one with several of you all also on the call. So what we're hoping this is going to be from start to finish is not just a review service, but also an educational experience and an opportunity for collaboration. We're hoping that we add value to it by including the state and local jurisdictions that have firms that want to have their HACCP plans reviewed. We're going to have opening calls, email threads, closing calls for each of these reviews, and want to invite all the key people to the table so that everyone's on the same page. So jurisdictions as well as retail food establishments are welcome to use this service. It's the same cost for both. And thinking about it this way, if you have an incoming HACCP plan that's already been reviewed by AFTO, well, let's say that's going to be a HACCP plan that's performed in 10 different states. Well, that could save, at least on a national scale, hundreds of hours of having to review that same HACCP plan in each individual state. So I want to show you this kind of a skeleton of our process flow chart. And this is just a real high level, kind of 10,000 square bird's eye foot level of what's going on here. I'm going to move this blue oval just down the line here as we go through this. The items that are in yellow, these are things that are occurring before or after the payment periods. So we're talking about a 6-month review period for each HACCP plan review, starting off with when the payment is actually received. Prior to that, these items that are in yellow, these are consultative items that we're doing free of charge to be educational, to be helpful. Hey, we've got free templates. We've got the AFTO guidance for developing HACCP plans that specialize for specialized processes at retail. We have several free resources available. And I'll go to that one next. We're going to revisit that template a couple of times here. So yeah, we've got links to the templates that are already associated with the AFTO guidance for developing HACCP plans. I won't talk too much about this guide because Jonathan Wheeler will cover it in more depth in a couple of minutes here. We do have some checklists also built into the service interface on the website to provide prompts of which documents, which items to address for those 7 principles of HACCP to make it hopefully as easy as possible for the firm or jurisdiction to submit items for review. And of course, FAQs. And as the system matures, we anticipate adding more FAQs to this system. All right, back to the process flow chart. The oval here is covering, so now that we've got someone who's interested, they've got some education under their belt, they're writing that HACCP plan, they're using those templates and customizing them to their operation. Now it comes time to submit them to us to start the review. So we're going to kick off with an initial review of those materials once they hand them to us. They will get instructions for submitting materials securely into a private Food Shield folder just for that customer, just for their plan. We're going to do an initial check of those items and see if it has all the necessary information to cover the 7 principles of HACCP and other requirements. And so what this customer intake form looks like, I just have a couple of screenshots I want to share with you all. We'll send the slides out later, and this is a link directly to the website. So just a couple of screenshots. Some of them are truncated because of space, but I'll just kind of walk you through them. So first off, they've got that HACCP plan ready to be looked at. We have a drop-down menu here. It's got 6, maybe it's 8, I forget, but there's an other option where you can type in, like mollusk and shellfish display tanks if you want to. But anytime someone selects one of the categories already pre-written, we have it where it'll pop up the HACCP template specific to cook chill in this case. Or if it's curing, there are 6 or 7 items, including the Penn State curing calculation spreadsheet, all right there, depending on which one they select. And then it's going to walk them through this next step. Do you have all the supporting documentation that is required according to the 7 principles of HACCP? Again, this is truncated. It's going to have these bullet points kind of in digest form of what are just the facts, ma'am? What do I absolutely need to have a HACCP plan? And just making sure that they address all these things. They're really just self-reporting. And so if they say yes, they're able to move on to the rest of the intake form. And if they say no, the form will end there and they'll have to kind of go back to the drawing board and make sure that they have all those items addressed. So next down that form, just kind of going from top to bottom, we're going to ask them to include additional details. So we're going to want to be aware of any establishments that might want an expedited review. Do we have someone who wants it done yesterday? We'll do our best. But largely, we want when customers send in their HACCP plans, their idea is that we're going to review them on a first come, first served basis. But for those who would like to or don't mind paying double their original fee, we will do what we can to push them to the head of the line. Okay. Other items that we want to know, for instance, has this plan been previously reviewed and approved by a state or local jurisdiction? If so, and if we're getting it, it's already been looked at by someone else, we want to invite those jurisdictions to the table and be part of the discussions for this review, just to include everybody who's key to it. This blank right here is just a number input box. So if you're putting anywhere between 1 or 9 establishment locations where the HACCP plan will be used, you'll get just some pop-ups saying establishment 1, go ahead and give us that location address, email address, contact information, and so forth. And if it's more than 10, so 10 or more, what will pop up is a link to an Excel spreadsheet that'll make it easy just to copy and paste over establishment information right into that spreadsheet and then send that over to us. So we're asking for this information because at the very end of that process, the widget, the product, the output of what AFTO was doing is providing a final review letter. And so this final review letter, we're going to be able to tie all of the establishment locations that were identified earlier on, along with a unique number for the HACCP plan that was submitted. So it's all one neat package. Okay, so next down on the form, the primary point of contact, this person, not just because they're named primary, they're important because when they submit this information to AFTO, they will get an automated email that gives them instructions for the secure upload, that transfer of HACCP plan materials and supporting documents into Food Shield for us to take a look at. And then we ask for some backup contact information in case someone's on vacation. You can do the plus minus radio buttons to add or expand or, do as many as you need to, just so that we have someone that we can contact and help keep the process moving along. This terms and conditions area is truncated. It's a couple of paragraphs long. This is where we have those legalese items such as confidentiality, a hold harmless statement, the roles of AFTO and the roles of the customer in this, and so forth. And so then once they do their typing in their signature electronically and position title and click the blue button, so two things will happen. Like I mentioned, they'll get instructions for how they can securely upload their plan for review. Also, internally, it's going to shuffle all this information into AFTO's Trello board so that we can manage the process and stay on track and try to be as efficient as we can with the process. Okay, so I mentioned the clerical check a couple of times. So if I just go back here for a little bit, these yellow boxes, we're still kind of in that area where, we haven't processed a payment yet. We're still in that kind of that free consultative area. We want to make sure that the HACCP plans that we're receiving are complete before they go into an in-depth review. So this clerical check, this initial review, is going to be a check for completeness. So does that HACCP plan include all of the items that were in that submission checklist? Does it address the items that are required for the 7 principles of HACCP? Does it have a sanitation SOP? Does it have training forms? All the things that are required. Is it in scope? So for us, in scope means that we're doing basically retail specialized processes, HACCP plans for retail specialized processes. We're not doing any manufactured plans for this particular venue. Also, at this time, we're not doing variance requests. That is a state and local level function. We've been asked if we can include that, but for now, because we're just launching this, we want to focus on retail specialized processes first and then see if there's an opportunity to expand later. So along with that, we're not going to be doing MOP sync waivers or MOP sync variances either. So is it current? And so for us to be efficient, we're going to provide every AFTO review based on the most current FDA model food code. The checklist that we're going to be using is derived from the FD 312 Specialized Processes at Retail course. It's on the website too if you want to see a copy of it. The one exception is that because we're not doing variances, we've lifted off the variances row, that line item from the FD 312 checklist. But as long as it's current to model food code or the equivalent with FSI, if it's a meat process, that's what we're looking for. Okay, now we're to the point where we have a complete HACCP plan. It's now ready for in-depth review. And so now we're going to have our headquarters send payment instructions to the customer. So we're sure they want to go through with this because the fees are not refundable, just to make that as neat as we can be. When we have that payment process, that's going to be that first bookend versus the 6-month end of the close of the review. So everything you see in pink and in green as it kind of snakes through here, we're calling this a 6-month review cycle, even though we're really going to try to target 3 months if we can. It's going to depend on the complexity or the simplicity of that HACCP plan review. But either way, we're going to notify the customer. Let's say that the payment process today, your review cycle begins on September 17th, and it will end on March 17th of next year. There is an ability to extend that time if they wish. And that'll be dependent upon just, active participation. Is the customer able to respond with any requests that we have for more information or clarification or that kind of a thing? So we're saying 6 months. Um, if they need more than 6 months, they can extend that up to 1 year, which then brings me to our fees slide in case you're wondering about that. The fee itself is based on the number of establishment locations where they plan to use that HACCP plan. So we talked about earlier, if you've got one up to nine, that's we're going to charge you less for that versus having 10 or more facilities. If someone wants to expedite that review, we're going to ask that they basically send us double that original fee. So that would be 1,990 for one facility or 9,990 for 10 or more facilities under that same plan. The phrase here may include similar food processes with substantially the same risks. So let's say you've got a firm that wants to do cook chill of 5 different soups. So those 5 soups might have different formulations, but they've got substantially the same risks, probably pretty similar HACCP plan needs. So those could all be included in one HACCP plan request. Um, we talked about extension requests too. So we're saying from the bookends there at start to finish is 6 months. But if you need more time, life happens. We'll provide extensions for 3 months at a time for the charge of 250 and up to 1 year maximum there. Okay, so step number 4, basically we're going to be looking at that plan and seeing if this is something simple, just to pick on sushi rice for a little bit. If it's something that's simple like sushi rice, it probably doesn't need an extensive scientific review panel. We don't have to go to the library or to the stacks or, have to dive in deep with a fine-tooth comb through laboratory results necessarily on that one. So we might be able to skip scientific review on some of the simpler plans. So that's what this decision time is all about. We'll have 2 or more AFTO staff take a look at those plans and see if we need to invoke a scientific review panel or not. If we do, then we're going to follow those green steps in number 5 and number 6. When we do need a scientific review panel to come and take a look at this, we've got volunteer subject matter experts from the regulatory arena, several of which are on this call. We have a list of processing authorities. We have several contacts in academia and food safety extension that we could also call upon if there's a very novel process that we know we really should get help with to make sure that it's a safe food process. Also with the steps 5 and 6, with so many of us using Zoom and Microsoft Teams these days, we can hold a Zoom call and take a look at that process visually. We can have that firm walk us through their kitchen and it'll show us what your sous vide water bath looks like, show us what your ROP packaging machine looks like, and just take a look at that. So we're having that opening call either at step 5 or at step 7, okay, and inviting all the key players, so the firm, the jurisdictions, our panelists, et cetera. So everyone's on the same page. Oh, go ahead, Deanna.
Sally? Yeah,
Yeah.
we just have a question in the chat. I just wanted to alert you
Okay.
to. The question is, many of the chain establishments may already have HACCP documents in their own format, which may mean multiple documents. Does the upload capability allow for setting multiple documents as part of a single plan?
Yes, yes. So if you've used Food Shield before to upload a document, you can upload as many as you want to into that folder. So it's going to be a private folder just for that customer's plan. A few AFTO staff will have access to it, and so will the customer. And then we're going to move those files into the SharePoint so that we can share those with the panels later on. But yes, I mean, they're not required to use the free templates that are on the website. Certainly, we're going to encourage that because it just makes things more efficient for review and so forth. But if they've already got existing HACCP plans, there's no need for them to rewrite those just to submit them to AFTO. Great question. Let's see. So Zoom call steps. Okay. Step 6 and steps 8, I won't spend too much time. These are both here. They both exist if additional rounds of review are necessary. So if you can imagine, here we've got information, they're being reviewed by the panel's getting feedback. Maybe they've got questions to ask the firm or the jurisdiction. So if we need multiple loops of review like that, that's what step 6 and step 8 is all about. So I won't focus too much on those besides that. All right, so once scientific review panel is done, then no matter what, every single plan gets a regulatory review just to make sure it's meeting food code requirements. We're meeting the 7, if we're able to skip the scientific review panel, are we meeting the 7 principles of HACCP, et cetera. So again, everything gets multiple levels of review. You get an initial review before payment occurs. You've got a scientific review panel for complex plans and novel processes, and everybody gets a regulatory review done. So we're going to recruit folks beyond, we have folks within AFTO who have a very deep knowledge, and also many folks in this room and also beyond that live and breathe the food code and know, from the top of their, kind of shoot from the hip. They know exactly which line and verse to go to. Once regulatory review is done, step number 9 is basically, it's kind of a QC step. That means that we have done due diligence to go through all levels of review necessary. Now we're kind of wrapping things up. We're getting close to the end. We are drafting that final review letter. Again, that's our widget. That's our output for this process. The panel is going to be having that final review letter with some components that'll be the same across all letters, but they're going to customize them based on, basically it's a canned email, right? We're just going to customize it to that process and to that customer. We talked about using the FD312 checklist. We want to have an executive summary of that checklist, just the highlights to put into that letter. Again, to be educational, and just in case we've got new people at the firm who are not familiar with HACCP, or maybe there's a new inspector doing a verification audit, we want to give them some tips and hints, maybe the top 3, 4, 5 things to look for. What are the things that you definitely want to be keeping records of and make sure your employees have access to at the firm? If it's sushi rice, make sure you have that pH meter calibration record and your pH record of that batch of rice, what the pH was at the end there, those kinds of things. Once the letter does get issued, we're going to stand behind its validity unless one of 2 things occurs. As you all know, once a specialized process has been approved at the state or local level, we know that that firm is then on the hook for adhering to it every single time it's performed. Otherwise, it's null and void. Also, the letter is going to stay valid for as long as the wording in FDA Model Food Code doesn't change for a specialized process. So if we get a different model food code, maybe it's 2024, 2025, and we've got new wording for a specialized process, we'll have to modify our review as necessary so that we're meeting that new requirement. Okay, almost done here. All right, so we're going to have that closing call at the very end, invite all the key players. And in that final discussion, we're going to talk through the contents of the final review letter, ask if there are any final questions, and then wrap up with the final steps. The final steps then being asking if there's any feedback that people want to share with us, in the closing of the review. We're going to send a survey out at the very end. If you've been with AFTO for any of our events, you know that we love to get feedback and looking for ways to make things better. But with that closing call itself, again, we want to have the firm there, the jurisdictions where that firm is licensed, the reviewers, so the panelists will be on that call. Also, where possible, if the person who will be reviewing that HACCP plan at the state or local level for approvals of HACCP or any variances that might come after, it's a good idea to have them on that final review call as well. Okay. All right, so in closing the review, yeah, we want to get some feedback, and we'll talk about records retention too. One of the benefits we want to have from this service is that once everything is said and done, there will be a private folder just for that HACCP plan, where anytime a jurisdiction wants to go look up that final review letter or other records related to that review, they would have access 24/7 in Food Shield. So we'll talk about that during that final closing call as well. So in a nutshell, that is the new service that we've launched. I'm going to open it up for any questions at this point. So thanks for your attention.
Feel free to raise your hand or use the chat function, either one, if you have any questions for Sally about the way this process works to help reduce the resources needed for HACCP plan reviews.
And if not, I'll put my email in chat too. So I know some of you guys are shy.
Well, we're all in the same boat, so I hope we don't stay shy for long. But that said, if we are going to have some time. Oh, Sammy just raised his hand. Go ahead.
Hi, a lot of great information, and I'll have to give this more thought, but I think this will definitely be helpful for a lot of local jurisdictions that are challenged to have like a facility that wants to do a HACCP, and they have pretty limited resources and overall, and have very little experience with doing this kind of in-depth review. So um, appreciate y'all providing this service.
Thank you, Sammy. I appreciate that. John.
Yeah, I just wanted to comment that one of the biggest reasons why this was proposed, and I'm really glad that AFTO is pursuing this, is because of the fact that those chains that operate in multiple jurisdictions have found HACCP to be an absolute point of frustration where jurisdictions can't agree on what a HACCP plan should look like or what it should contain. And this is really part of a multi-pronged effort to try to drive some more standardization across the country in how we review these HACCP plans. We're not doing ourselves any favors if we cannot reach consensus on what a HACCP plan really should look like for a specific process. And I'm really, really hopeful, and I'm very grateful to AFTO for stepping up and pushing this. I think this can be a great benefit to those chains that operate across multiple jurisdictions.
Thank you very much, John.
Yes, well said. Thank you. All right, do we have any other questions for Sally? We will have some time at the end of the other panelists' presentations for more Q&A. So if something comes to mind while you're hearing someone else talk, just put a little pin in it and we can definitely circle back to it before the call is over. So Sally, I'll hand it back over to you to introduce the next panelist.
Thank you, ma'am. So our next panelist is going to be Veronica Bryant from North Carolina, and she's going to talk to us about another new initiative. After was given a home to the Retail Specialized Processes Mentorship Program. So I'll run your slides, Veronica. Just give me some cues.
Yeah, thanks, Sally. So we have, along with what Sally was just discussing, have set up a group of, and I don't know if you can go back to the slide that was right before this for just a second. It looks like it's there. One more. Yeah. So there is a group of 6 of us across the country, mentors who have been really working together over the last several months to put together a collaborative group to kind of help everyone across the country with this idea and this problem of trying to review these specialized processes. And this really kind of came about in a organic kind of grassroots way where the 6 of us would start just emailing each other when we would have questions about specialized processes, because we were responsible for them in our own states or jurisdictions, and knowing that this is difficult stuff and we couldn't know everything on our own, we would say, how do you feel about this, or have you ever seen this? And so kind of wanting to extend that in a more national way, we work together with Sally, and AFTO has been really great in support of this. So Sally, if you'll go to the next slide, and I'm not going to read this whole long mission statement out, but this is kind of the purpose of our mentorship program, and we just want to have a place where everybody can come together, get greater understanding, get their questions answered. All of us can learn more, and like John was just saying a minute ago, just have a try to come to closer to consensus on a lot of these chain establishments, and where we're all kind of viewing these processes and reviewing stuff in a more standard way. So in order to do that, Sally, if you'll go on to the next slide. The biggest piece of what this mentorship program is our quarterly calls. And in order to join the quarterly calls, there's really two ways to do that. We have a Food Shield program. So you can join the Food Shield and you'll get automatically added to the roster for the quarterly call from the Food Shield, or there's a survey that we had that you could fill out. So if you're interested in joining, or if you have staff that you would like to join, you can reach out to Sally and she can get you the information. Each time we have a call, we're going to have a topic that we want to discuss, and we are going to ask for ideas and questions. The 6 of us will discuss those ahead of time and get some answers so that we can have those discussions, and then we'll get together and be able to have those answers ready for you during the quarterly calls. So you can go to the next slide. This really is meant for our regulators only, for state, local, tribal, territorial jurisdictions. We are excited to allow our federal partners to join us. I think on our first call, we had several of the FDA folks join us, and that was really great to have them there. And, that helped with our understanding, and, really helped with the interpretation and stuff as well. But anyone really who is involved in the special process review is kind of who this group is for, or if somebody who's getting more into it or who needs a refresher. And we're going to try to do this quarterly. So January, April, the third call of the year, we're going to try to hold it in conjunction with the annual educational conference. So it may not be a call, but more something that we have during the conference. And then October, and then our plan is for those to be roughly, I think we landed on like an hour and a half, because an hour is kind of short when these topics are so long, and we know that people have a lot of questions, but we also know that your time is very valuable. So we're really trying to listen to what everybody wants in terms of these in terms of this mentorship program, and really tailor what people's needs are. And our group is trying to just work with everybody to just kind of help and support in the best way that we can. So if you'll go to the next slide, Sally. And so we have a Food Shield set up, and anyone can request access to be part of the mentorship program and get access to the Food Shield. On that Food Shield, like I said, you'll get access to the quarterly calls, but we also have a discussion board where if you have a question that comes up in the months in between the quarterly calls, our mentor group will answer those questions, in the meantime, or you can have discussion with other people across the country about, things that you're seeing. We have some papers, some scientific papers and other reference papers on that Food Shield site. If you have needs for things like a reference on kimchi or, different things that you need to see about yogurt, that all that stuff can be found on Food Shield as well. And then some of the template stuff is there also. So if you want access to the Food Shield, you also can let Sally know. And I know that she put her email in the chat. So please feel free to reach out to her to get access to the Food Shield and to join our group. And so there's one more slide that I was going to cover, and that is that our next call is coming up here pretty soon on October the 18th. And that will be held from 12 to 1:30 Central. So that would be 1 to 2:30 Eastern. And if you want to pre-register to get the Zoom link, there's the survey if you have questions. So you can get access to all of that through Sally. And you can get some of that through the AFTO e-news as well. But since Sally's email address is there in the chat, please take that and use that, send that, get the link to the survey and send that out to all of your staff. We would love to have more people join us. The first call was super successful. We had a lot of positive feedback. We discussed kind of the makeup of the group and ROP of raw meat, and we had some really, really great discussion. And we're really looking forward to our second call and carrying this forward. I know the six of us, Amanda, Carrie, John, myself, Ray, and Tara have all been really passionate about this and working together and really wanting to help take this forward for a long time. And so we just are super excited to be able to work on this project. And so anything that we can do to help support your jurisdiction in your special process program with this mentorship program, we're happy to do it. And we really want to see this grow over the next year. And with that, I am finished and can take questions before I turn it over to John.
Looks like Sally has already put the Survey Monkey link in the chat. So we've already got that resource out there and available. Again, you can either raise your hand or put the question in the chat if you have any for Veronica. Okay. With that, if you do think of something, keep it in mind because we will have some more Q&A at the end of the call. All right, Sally, I will turn it back over to you, or I guess to Jonathan, since he is our next panelist on the call. Thank you.
There we go. Hi, everybody. Thank you for joining us today. We really appreciate your interest and your attention. Wanted to give you first a little bit of background about the work group that worked together to create this new guide for AFTO. This really started in 2020. between myself, Felissa Vasquez from the Asheville Buncombe County Health Department, Melissa Ham from Wake County, North Carolina, um, Joe Corby, of course, we've got to have Joe Corby, and Jim Topey from the Minnesota Department of Health. So it was really important, first of all, that this was driven by county and state health departments, because we see so many different needs. And we've had a lot of conversations with other, our counterparts in other jurisdictions. So we've listened to, the concerns, and, we knew that a lot of jurisdictions were really struggling with the special processes and having a lot of questions, not really knowing where to turn for help. And so in 2021, we really organized ourselves with AFTO's blessing into a work group to develop better guidance. We wanted to develop more complete guidance. And we started from a guide that AFTO published in 2014. But we realized that it really needed to be more focused towards retail. One of the things that concerned us initially about that guide was that it felt like that it was more addressing towards manufactured food. So there was a great need to simplify the material, have it more focused on retail, present it at a level that as best we could make it happen. We wanted to make sure that it was presented in a manner that's understandable for folks with no science background. So that was really our core principle in writing the guide. We conducted a survey through AFTO in August of 2021 to help inform our efforts. One of the questions that really, there were two questions I'd say that really impressed us as emphasizing the need for this guidance. The first of those questions asked for each respondent, and this was done at state level, so this was not even addressing the county and local levels, this was state level programs. The first question was, how would you assess the strength of your special process program? We asked for a score based 1 to 5. The average score came out at 72%, just a little over 3. That was alarming. The next question, we asked the respondents if your jurisdiction would be able to provide assistance to another jurisdiction that felt like they had questions or needed some additional support. Only 42% responded affirmatively to that question. So we realized that for us to be able to regulate effectively, we have got to better educate ourselves. We have a responsibility to educate our customers as we go through this process of reviewing HACCP plans, verifying their performance on the HACCP plans. We need to be able to educate. We can't do that if we are not prepared to do so ourselves. So some of the gaps that were identified through this survey included the need for templates, standardized type of guidance to provide, number one, a checklist for the reviewer, but also to provide specific guidance for a specific process to the retail operators to help them understand the information that needs to be provided to create an effective HACCP plan. Some of the processes that were identified that the most frequently as needing more support included fermenting foods, sous vide cooking, and various meat preservation practices. These were all major gaps. Fermented foods constitute about 40% of all the foods that are consumed worldwide. Meat preservation practices, if you've taken FD 312, you know that it covered a couple of processes, fully cooked cured sausage, covered fermented sausage, jerky. But in practice, what we see is, for example, hams that are not cured with nitrite, but they may be cured with sugar or salt. We see bacon. We see all kinds of other cured meats that may or may not be cured with nitrite. Some involve no cooking step in the process, so the finished product would have to be cooked before it is served. So there were a whole lot of different variations that we just did not have guidance for. So that was another thing that we felt needed to be included in this guide. Of the additional resources that were requested, guidance documents, again, was right at the top of the list. Reference materials to help answer questions that come up. Everything that we deal with on a day-to-day basis is not necessarily spelled out in the food code, because the chefs, the culinary trained folks, they're coming up with variations, and we have to figure out how to address them. So there was a great need for more resources to help answer those questions. 94% of all the responses indicated that retail operators needed training and resources presented at a level that is suitable for people with no science background. These chefs are creatives, they're not scientists. So we have to be able to explain it in as close to plain English terms while still addressing the concerns. So this guide was written to provide that industry support. Again, as well as we could, we tried to make it close to plain English in a teachable format with a lot of examples to help with the understanding. We also needed to provide that regulator support, and we felt that by addressing the needs of industry, then we're also providing for the information that regulators need to help in assessing these processes. We included a lot of information that we have garnered from various conversations with our FDA retail specialists. When questions come up, I know Donna Wanucha and I always had a very special relationship, because she knew if I sent her a question, it was going to be a doozy. And we gathered a lot of that type of information and included that. So we've built on that foundation of FD 312 to just include a lot of additional resources to answer those questions, some of which may be kind of off the wall, that come up on a daily basis that make our job a little bit more challenging. So Sally, if you would you please pull up that table of contents from the guide, and let's kind of scroll through that so you can see what's there. Thank you. So we start out with definitions. We give some basic discussion about prerequisite programs and how they support HACCP as a food safety management system. And then in the preliminary steps, we go through step by step. The way I describe it is throwing the pieces of the puzzle on the table. You cannot put the puzzle together until you've got all the pieces on the table and you look to start seeing where things fit. That's what the preliminary steps are all about. So we describe the whole process of gathering that information to be able to create the HACCP plan. And then we move on to the 7 principles of HACCP. And this is where we have the first worked example where we actually work through the process of identifying the hazards in producing a jerky. Was the example we used, a cured jerky. We analyzed those hazards using, again, a risk assessment matrix, which is, there are others out there. The one we chose so makes it very clear how to rate each potential hazard. We then identified critical control points. We explained what that means, what a critical control point is or is not. And then we talked about, determining the critical limits. The critical limit is basically the guardrail at the edge of the cliff, so to speak, that you don't want to go over. If you miss the critical limit, your product may be unsafe. We explain all that. We talk about the monitoring procedures, corrective actions that are required if a critical limit is not met. We explain in great detail validation and verification and what the difference is between those, what are the components of verification, the different forms of verification, and then the required record keeping. Section 4 addresses the required contents of a HACCP plan. We talk about when variances are required and emphasizing the need for compliance with those approved procedures. So again, this is a very teachable format. It really helps retail operators understand exactly the process of developing the plan. I do strongly recommend, and I can tell you, we are using this guide here in South Carolina to develop training for our inspectors. I know of a number of other jurisdictions that are doing the same thing. It is an instructional format, uh, as well as providing that guidance for industry. I just want to emphasize the value of this document as a reference because of the amount of information that has been compiled here. Again, as I mentioned earlier, some of the information that you would not find in FD 312 has come out of our discussions with FDA retail specialists. We had a lot of people contribute to the review of this guide. More than 20 other state and local jurisdictions helped with the review. Glenda Lewis's team at FDA also provided a final review. And we're very grateful for their extensive input to make this guide what it is. Going on from the coverage of HACCP, we then moved into coverage of each of the process categories, reduced oxygen packaging methods, covering each of the categories in 350.212. There's a good bit of discussion, especially in the sous vide portion there, about some of the questions that come up, for example, low temperature cooking. And concerns that can be associated with low temperature cooking in a sous vide environment. All that's really important and useful discussion there. And then section 6 was written by NC State University. And again, there are numerous examples of specific types of products and processes there. It's great resource there for those meat preservation processes. We have hot smoking of fish, which was based on a Pacific Northwest HACCP model for hot smoked fish. Aging of beef is another question that comes up fairly regularly at retail. There is some safe guidance that is out there, and we chose to include that because of the fact that that does come up fairly regularly for us. Then in section 7, we covered the other processes that are considered special process by a food code 350.211. Each of those categories is covered. We talked about potential hazards. We included coverage of cold pressed juice. Custom processing is another one. It's like, the question had always been in my mind, well, if we don't regulate custom processed meats, so for personal use, how exactly do we make them write a HACCP plan? Well, there was an example that came across my desk where we had a retail meat market that had built a room onto their facility for doing custom processing. They were doing ROP for retail meats, and they needed to write a HACCP plan for that. And so the example we provided there was how we worked through that process of providing the guidance to incorporate the required controls for custom processing, namely separation, sanitation, and labeling. How do you incorporate that into a retail HACCP plan? So it's a great worked example there. We talked about other processing methods that require variance, and there are probably as many of those as there are trained chefs out there. One of the other sections that I was really excited to include here was the application of preliminary steps 2 and 3 for assessing unfamiliar processes. So when any kind of unfamiliar process comes across your desk, those preliminary steps 2 and 3, identifying the product, process, packaging, labeling, distribution, intended consumer, and intended use, all of that is your roadmap for how you would address any unfamiliar process to at least determine, do we need to have this further reviewed? Does it need a HACCP plan, or is it good as is? Or are there any particular controls we need to focus on? So that is another section that I think will be very useful to you. And then in section 8, we have the HACCP templates for the processes that are listed there. Each of those templates is available on AFTO's website, and they're available for download. Strongly encourage the use of templates. I can tell you in the 10 years of our program, The use of templates and just a teaching approach, a mentoring approach with our customers has greatly improved the efficiency of our review program. We have reduced the average number of revision and review cycles from about 6 or 7 down to 3 versions. So the use of a template is a tremendous help to your customers. It's a tremendous help. You can use the templates as a checklist. So anyway, I just wanted to commend all of that to you. And just hope you will make use of it for training. Share these documents with your customers. I will tell you that I have shared the information, the availability of this guide to all 6 of the culinary colleges in South Carolina, and we partner with all 6 of those colleges in one way or another to get in front of their students for teaching. And they all were very appreciative of that information. It really helps them because as they're teaching these processes, the students need to be aware that they cannot just go out into industry and do the process without getting the process approved. So this really gives them a leg up on understanding those requirements. And that is my presentation. Thank you for your attention. Do you have any questions?
Yes, that's always an impressive amount of stuff that y'all have in this guide. John, I always want to just like, wow, every time I see it. I had a comment in the chat that this looks.
Thank you, Michelle. We appreciate that. All of us
Great resource. So glad
that felt like we needed to have a celebration party when we finished
it. Yeah, more comments. They love this. Okay. All right. So with that, if I could have the other 2 panelists back up here, and Sally, I'll take over sharing the screen again.
Thank you.
So any questions for Veronica, Sally, or John? Still getting lots of great comments here coming in the chat for kudos of the guide, and that this is timely with the Food Safety Advisory Committee coming up. And I think this is also very timely with CFP coming in and the potential issues just right around the corner. All right, I see no hands raised. No questions in the chat. Move on to the next slides that we have. All right. Yeah, I think everybody wants to get their hands on these resources before they have questions. And if you do have questions that come up after the call today, please feel free to reach out to Sally, myself, or the panelists on the call. We have some links and resources that have been put in the chat. Quick reminder, download it for free or purchase a beautiful copy that has tabs for every section and full color. And it's an impressive book when you actually get it in your hands. We have some sample copies that we've been showcasing at all of the FDA retail seminars. And everybody, when they see the printed version, that's the one they want because it does look so user-friendly. There's many other resources there. Website. So check out lots of cool stuff for you to take and share with your staff. And if you want to know how these resources are created, you can always join an AFTO committee. As John mentioned, they work with the AFTO committee to get this completed. We have committees on all of these 12 areas that you see here on the screen. And you don't have to be an AFTO member to work on a committee, but we strongly encourage it, because then you'll be in your name to join one of the committees. I hear I'm freezing, so I'm going to turn my video off and hope that helps. Hopefully the freezing wasn't too embarrassing. All right, so next slide. Go to our website, tons of information. I know you all have a lot going on, but the things out on our website. We have, it was 40 languages. Now it's over 50. We have over 2,200 different translated handouts there on the website. Fantastic resource for your field staff. And then last but not least, I want to encourage you to complete your evaluations for future topics for these calls. And our next call, the invite will be coming soon for December the 3rd. And it will be the ORFP, Office of Retail Food Protection, which is formerly known as CFSAN, come October the 1st. And we're going to have them on the call to talk about the 2024 Food Code Supplement. And then we're trying to do the one in February a little bit early so that we can avoid any potential conflicts with the upcoming CFP in Denver in March. So please let know on the evaluation, and we'll be sending out you might have missed. Thank you all for attending, and looking forward to the next call. Have a great day.